The Jacob Center has been delivering COVID-19 vaccines for nearly a year in southeast San Diego, but that's ending Thursday. County officials have been looking at closing their vaccination sites that have low volume and shifting efforts to mobile teams and local providers.
Versus a static site, which aren't bringing in the numbers that we had initially, and definitely have dropped off. And in some situations, in particular Jacobs Center, we're seeing well below 20 vaccines a day.
Denise Foster is the county's chief nursing officer. She says currently only about 10% of the region's vaccinations are happening at county sites. The bulk of them are given out at pharmacies, hospitals, and clinics.
Which is, really looking to go to the model that we've always had, which is where the safety net for those who are most in need and underserved in the community.
Meanwhile, there has been a slight uptick in vaccination appointments here in San Diego. This week, the CDC recommended that those over 50 could get a second booster shot, but there's an issue. President Joe Biden says more pandemic funding is desperately needed.
We have enough supply to give booster shots to those newly eligible individuals. But if Congress fails to act, we won't have the supply we need this fall to ensure the shots are available free, easily accessible for all Americans.
The lack of funding is already impacting our pandemic response. Federal officials are cutting state allocations for potentially life-saving treatments, and
without funding, we're not going to be able to sustain the testing capacity beyond the month of June. And if we fail to invest, we leave ourselves vulnerable if another wave of the virus hits.
Experts are predicting some sort of case increase with the more contagious BA.2 variant, now the dominant strain in the U.S.
Yeah, this is incredible to see our funding cut when we have a wave that's just getting going right now.
Dr. Eric Topol is director of the Scripps Research Translational Institute in La Jolla.
This is the last time in the world to cut funding, essential funding, whether it's testing, vaccines, monoclonal antibodies, treatments like Paxlovid pills. This is crazy, and it shouldn't be tolerated. And this is ridiculous complacency, not acknowledging what's going on right now.
State health officials say their priority remains ensuring everyone, regardless of their ability to pay or insurance status, has access to testing and vaccines. They say that COVID services should be provided based on need, not specified funding sources. Matt Hoffman, KPBS News.